Hello. Hey, May, it's Amanda.
Hi, Amanda. We can't get in the Hall of Justice because it says Donald from the School-Based Health Center State Program Office, and I am pleased to introduce Kristen Case from the Multnomah County Health Department, who will be our presenter today. Kristen has been working in the Multnomah County Health Department School-Based Health Center program for over 15 years. In addition to practicing as a nurse practitioner at the David Douglas Sbhc, she is also the lead clinician for the program. Her passion in adolescent medicine has been to develop guidelines and support for medical providers in the area of mental health. She has partnered with mental health colleagues to develop guidelines in suicide prevention and depression for the Multnomah County Health Department Sbhc program. She has also worked with OCHIN to develop an EPIC tool to integrate bright futures into the Sbhc practice. She has presented both at the state and national levels on these topics. So with that, I'm going to turn things over to Kristen. And Kristen, I'm going to unmute you. Okay.
Okay, got it.
Great.
Hello. Okay, I'm on.
You're on.
Hello, everybody. I think, thanks for the intro, Kate. And I think the other thing I wanted to say is I first became lead about 5 months before we moved from paper to electronic charts. So that seems like a long time ago, but I still remember the angst of it, and I remember how much work it was to move forward. And we were the first school-based health center to actually have EPIC in, I think, in Oregon. So there were a lot of lessons learned, and the areas we started in, we've actually tweaked to try to develop better workflows. So in trying to, I know that there's a wide range of an audience out there, people who have been on EPIC for a long time, people who are just getting up on EPIC. So I'm going to try to speak to a wide range, and I'm hoping not to lose people, especially people who have not been in EPIC for a while. So I was going to talk, or actually have not been in EPIC at all, overview and history, the Bright Futures integration, and then really talking about some workflows within EPIC, which might be overwhelming if you don't know EPIC, the Visit Navigator, the episodes, talk about the episode report, and then something that was recently developed in the last couple of years that we worked with OCHIN on is developing an Sbhc smart set for our wellness and our sports physicals to really try to meet the metrics that kind of work within the work we do in school-based. And then I was able to get permission to do a demonstration in release, which is kind of the EPIC tool of playing in. And the other thing is May, who works with the OCHIN, can also pipe in. She and I started this work together years ago, and so she is really on the technical functionality side, and I'm on the clinical side. So I think between the two of us, I think it's a good combo. So why did we do this? Well, when we first went live 7 or 8 years ago, we didn't know anything, and we thought we got one ask, like you in school-based can ask for something to be built for school-based health centers, because it was really, I felt like EPIC was more an adult-focused tool, and so what we did is we developed this risk assessment where you just push the buttons when we actually did the topics that we covered. So a couple years into it, we're like, oh, can we do something better? So then we partnered with the state to develop something with EPIC once we've been working in the system for a while within our practices. And the other thing that happened, at least in Multnomah County, is we started seeing younger kids as well, and so the tool that we had for adolescents didn't really work for the 5- and 6-year-olds. So what we wanted to do is facilitate a standardized comprehensive care model based on Bright Future recommendations. We wanted to move away from the risk and really incorporate a strengths-based approach. And we wanted to try to develop something that could look at client outcomes, that looked across to see if these kids who we were concerned about before were kind of starting, they were decreasing risk or really doing better. So we were trying to develop something that was focused on outcomes. So in looking at Bright Futures, a number of years ago with the ACA, they really nationally adopted Bright Futures as their model of providing preventive care to kids. So we we embraced the Bright Futures model, and we looked in there and we really tried to figure out how we can move Bright Futures over into EPIC. I even have gone to some National School-Based Health Center meetings and have talked to people who also use EPIC, and some people in Bright Futures and APA, in the AAP, and wondering why EPIC has not developed something that was more kind of child-friendly around preventive care, and EPIC has even identified that there's not a lot of functionality that's already been developed. So we came in and did the best that we could. So we looked at we wanted to highlight themes across the stages. So we really looked at themes that were really across that whole school age all the way through adolescent ages, and not just have terminology that was just adolescent focused. We wanted to identify strengths, because Bright Futures is all about resiliency as well, and also thinking about starting with priorities for the visit with a focus on the client-parent concerns and providing a framework for the well-child visit. So I'm going to use some terminology, and I'm going to define some of it just to make sure we're all on the same page. So when I say a health assessment, I think the state uses this word too. It's the tool used by Multnomah County to document a review of health maintenance topics with youth. We deliberately changed this. Years ago, it was risk assessment, and that was, again, we're doing this paradigm shift away from risk, which is also resiliency and looking at strength. So when I say health assessment, it's really looking at the topics that we review annually with kids. And then so what we did in Multnomah County, we decided that to have a comprehensive health assessment, we had to cover all of these themes. So what we did is we changed our old themes into a more, again, strength-based approach. So physical health, nutrition, activities, oral health. A big focus for us has been oral health recently. Emotional well-being, school and friends, safety, risk reduction, and then the strengths identification. So we really tried to move topics not only that were more strength-based, but were more friendly for the younger kids age group too, and an age-appropriate way of looking. What does emotional well-being mean for a 5-year-old versus a 16-year-old? Very different. But still, you can use that theme to cover the ages. And then the next thing we did is we looked at, in those areas, really starting to think about stratifying them. And this also is in Bright Futures. So it's this preventive message, this problem ID and identification, and referral and follow-up. And the easiest way to explain it when I'm talking to providers is that low, moderate, and high-risk kid, but not calling them high risk, really trying to change the terminology to something a little bit more positive. So when we look at preventive messaging, it's really that anticipatory guidance. And then problem ideas is something a little bit more, you're wanting to do some type of intervention. And then referral and follow-up is our higher risk kids. So this is what it looks like in EPIC. And so in EPIC, you can see the themes, you can see the physical health and nutrition, you can see oral health, and you can see emotional well-being. So what we say is you need to, and when we first cover it, it's not always about intervention, but annually we need to at least screen for it and assess for it. So annually we need to be pushing the buttons that are, one of these 3 for each topic. So that's mandatory for it to count. For us is that at least you're stratifying each area. The ones on the left we'll talk more about are topics covered, and it's definitely not, it was not built to say, okay, every kid, you have to cover every topic. It really should be specific to where the kids' needs are. So this is just a tool for people, and it's just kind of a drop down what's most appropriate for that kid. But a mandatory is covering each of these, and that's how we pull the reports. And you can only push one button. So again, the topics are really the anticipatory guidance topics across the ages from 5 to 21. You can click them, you don't have to click them. We don't report off of the topics, and this was a very confusing thing when we first went live on this. People felt like they had to push every button to make things count. That was not true. It's just an umbrella of options. Again, the theme should be reviewed and level of intervention checked annually. The preventive message, again, the low risk, it's more around the anticipatory guidance, i.e. puberty education. So a lot of our kids really do live in the preventive messaging for a lot of our topics. So the next level, the moderate risk, is problem identification and intervention. So really, that's where, you know, you identify, for me, for kids who are overweight or obese, I frequently put them in problem identification and intervention. And again, when we first push the button, we actually talk about this is an assessment. This doesn't mean you have to intervene, because people get boggled down. This takes forever. This is too much time. It's like that first time you're just stratifying and you're really kind of thinking about how you're going to stage care. So like in a well child, you're identifying that there might be some concerns, but you might be having them come back, but you're at least kind of doing that level of assessment. And again, in moderate risk, this is what it looks like, problem ID. Referral and follow-up are kids that we're really concerned about. For example, a kid that has a positive PHQ-2, and then we do the PHQ-9, and it's looking like there's some depressive symptoms. And so these are the kids that we're thinking we're going to definitely, if we're not going to do intervention today, which frequently we're not, we're going to develop a plan for intervention, which might be a referral. And this is what it looks like. And then the other thing I wanted to say around when you look in the EPIC tool, there's a section, there's this free text area, and that can be a really powerful area. That can be, you know, people say, I want to, when the kid comes back in a month or they're seeing another provider, who is this kid? What do I need to know about this kid? So this is a free text comment section that you know, when I get busy, I don't write a ton, in all honesty, but when I really want to remember something about a kid, I do free text into this. And the nice thing is, when we first went live with this free text would not permanently live in that visit encounter for that day. And we worked with OCHIN so that what would happen is it does live permanently, so it's a part of the permanent chart. But also, when you pop it up in the future in another visit, you can delete the free text and start over and say something different about the kid, but you still live with that permanent kind of initial part of the chart when you wrote it. So the next thing I wanted to talk about is when you do this work, it's really important not to kind of toggle out of it without clicking accept and close, because that was another thing, is providers would say, I did it, but I don't see it. Well, they would forget to actually click on that button whether it was accept and close. So that was a really important component that was oversight initially for a lot of people. So in the visit encounter, you can actually see if this has been done, and this comes into every visit encounter. So let's say you're seeing this kid for a sore throat and you saw them 2 months ago and they had their wellness visit. Well, when you open up your visit encounter, you can actually see it. So it can be tickler for who is this kid and what do I need to remember and maybe what do I need to follow up on, without really kind of going into a lot of different parts of the chart. It actually will live in the visit encounter. So again, this is what it looks like in the visit encounter, and so what you can see is you can see a couple of things. You can see where the stratification is, and you can also see the comments. It's a little funky the way it's been set up, and so you kind of have to look closely at if the stratifications has been done, but the comments come out really nicely. So this is just a little plug for strengths, which I just think is such an important part of working with adolescents. And so what we did is like, how can we put this in our new EPIC tool? So what we did is we created some buttons below the main themes of what we mandate people do annually. And we also, and this was also from one of the Bright Futures resources, is defining what that meant, because for some people it's like, what's achieving developmental milestones mean when you're like 16? And so what we did is we actually put that in, and then in our forms, which I'll show you in a while, we actually have open-ended questions that really target those. And I'll tell you, I love this part of it. The two areas that are really, well, there's a lot of areas that are important, but the two areas that I tend to gleam on is family support, kind of who they feel is a support to them as an adult. Of course, it may or may not be a parent. And all the way down to community involvement. It's like, what are you doing outside school? Are you working? Are you doing sports? Is it church? So it just is a really nice balance to when you're asking about, have you had sex? Are you depressed? really kind of getting a better gestalt of where the kid's resiliency is. So this is what the strengths part looks like below what we just looked at, and I'll show you in the big picture when we go through the demonstration. But we initially had buttons that said yes and no, and what we decided to do is we asked OCHIN to just change it to a yes, because what we really want to do is put in here what the strengths are. So if you aren't identifying strengths, then you just don't push a button. But again, that's where I will almost always put in kind of who they see as their adult figure, and community involvement is another area. The area that I also love is achieving developmental milestones, and I think the way we ask is, what are you doing now more independently than what you did a year ago? And this is in our adolescent survey, and it's driving, or it's going out at night by myself, and I love the answers some of the kids give around those questions. So the other thing that we did, which is kind of nice, is when you toggle on it, it actually defines what we mean by it. So if you're actually doing a verbal review, which occasionally I'll do a verbal review, it's like, oh, how should I ask this question because I may have forgotten. It actually helps give me a definition of what we mean by that. So what I wanted to do right now is I wanted to stop for a minute, and I wanted to see if there's any questions, and I think Kate was going to help facilitate that.
Yeah, thanks, Kristen. So there is a question box to the right of your screen. If you have any questions about what Kristen's covered, you can just type something in there. May, I think we're going to go ahead and unmute you as well so that you can answer any questions that may be specific.
Be really quiet while I'm finishing this. It was really, you guys don't know this, I'm on a webinar, and I can totally hear everything. I was really having a hard time.
Can we unmute May?
She'll be in office.
No, she's not.
Okay, sorry, I'm back.
Okay. So it looks like we don't actually have any questions right now, Kristen. Maybe we'll give people about 1 more minute to type in. But it looks like
we can always come back to if you want me just to go on.
Yeah, I think we should go ahead and we'll check in again at the next question point. Thanks.
Sounds good. Okay. So the next little definition I wanted to do is Visit Navigator. And it's the charting template that contains sections where you can document information related to many of the standard components of an office visit. And over the years, OCHIN has continued to develop it and make it more user-friendly. So I'm going to go into my next option. So when you look at this documentation, kind of all the way down, this is the Visit Navigator. And in the old days when we first started, I used to work a lot on the outside. And now, with the documentation, we're trying to work on the inside because it really is a more efficient way of working. So when you're trying to open an episode or do the health assessment, it's inside the Visit Navigator. So that's kind of what I want to show where it is in EPIC. And an episode is another definition. It is a functionality, and May, feel free to kind of expand, that has a beginning and an end. It is a way to keep visits that belong together for review, flow charting, and reporting. So for example, when we went to OCHIN and said, how can we do this, they gave us the option of an episode. So some of the examples of when episodes are used that I'm aware of is like in pregnancy, where there's a beginning and an end to pregnancy. Another place that they're used in Multnomah County is when people are incarcerated, and there's a beginning when they first get incarcerated to when they're discharged. So our episode definition is really a year, and so the beginning and the end of a year, and then you open a new episode. Did I say that right, May? I don't know if you're on. I'll keep going. So, one of the first thing you need to do is to get to the health assessment, to be able to use the functionality, an episode needs to be opened. It's in Visit Navigator under New Episodes. And so the way we do it in Multnomah County is we struggle with what should we put the name as, because we know it's going to be a year. So what we decided to do is we just decided to put the date in as the name, so that when we go back and forth to see when we need to open a new episode, the date is actually where it is. And then there's a drop down for the type, and this is where it's important to go to school age prevention health, because this is the episode that actually brings in all of the information. So you have to manually write in the date, and then you find the type, and then you accept. So again, just as a reminder, health assessments are captured in the episode functionality. It should be created when the patient presents initially. So what we do is no matter when a kid comes in, let's say they come in for a rule-out strep, we're not doing a wellness visit, we're not going to do the health assessment, we still have an episode created, and I'll show you why down the road. So that first visit is when the episode is opened. And then what we do is we keep it active and don't do a new one until the next health assessment is due. So the other thing is, and this is actually wrong, it says once the episode is created, the visit, oh, no, this is right. Once the episode is created, today's visit will automatically be linked, because when you see over here, this is a key button to make sure that they're linked. If it's not linked, then you can't get to that episode in that visit. And it's not hard to link it, but you just have to make sure this is linked. So to access the tool then, let's say you've done the episode, what you do is you click on the health assessment to get to the information. And then what you do is you link the episode if it hasn't been linked. Now we were hoping that they'd always be linked in office visits, and we're finding they're not, so we have to link them. I'm going to stop for a second and see if there's any more questions. Olga.
All right, so if you have questions, feel free to enter into the question box on the right of your screen, and we can share those with Kristen. And just to let you know, May, if you're listening, oh, it looks like you got the message. Okay, great. So we'll give folks another minute or so to enter in any questions. Okay. It doesn't look like we have any questions, Kristen. So
okay,
if you can
keep going. Okay.
Yeah.
Okay, so now I'm going to talk a little bit about how we make this work in Multnomah County, not because we are the only way, but we've actually kind of done a lot of workflows to develop how to smoothly incorporate this work into just our daily work. So what we do with our health assessment is we actually say it's always done during a wellness visit, including a sports physical, on an annual basis, and or within the first 2 visits, because I know the KPMs for the state changed to 2 visits. We used to be 3 visits, and now we're saying within 2 visits. So that is just generally where we do review the health assessment. We actually have forms that go along with EPIC, and so we actually have them fill out a form when we're actually covering this information. We have the forms in multiple languages as well. So another reminder is when we're covering the health assessment, it's all about screening. It's not necessarily about intervening at that point in time. And I always have to tell people this because they get, how can I do this work in such a short amount of time? What you're doing in that visit, you are assessing and staging the care and deciding what they need to come up for. You don't have to kind of do this full intervention around depression, but you need to identify certain areas like the suicide risk, but you don't need to do, this is all about screening and assessing what they need in the future. Our forms are organized by the themes. It aligns with the EPIC tool, and we do it while in an episode. So we have some forms, and I'm more than happy to share it. The way we've broken down our forms is for kindergarten through 8th grade, we actually have a separate parent-guardian questionnaire we have the parent fill out, because for the younger kids, we actually do a verbal review based on the questionnaire. And then for grades 6 through 8 and 9 through 12, we actually have a health assessment that the youth fills out. So this is our parent-guardian questionnaire, and what we've done is we've actually asked if the parent has any concerns about these areas based on the topics, and then we also have them fill out where they see their strengths are as well as where some of their stress is as a family. So this is what we review really with the family, with the child and the parent when they're coming in. And what I also like is, do they have any concerns? So really what this does is this is filled out before I walk in the room. So it really helps me before I go in the room know kind of what direction I need to go through for in a wellness visit, so that I'm not just doing this 45-minute talking at people. It's like, what are their concerns, and let's identify those first. So this is, and we've tweaked this, we've updated this, but so this is the 6th through 8th grade form that kids fill out, and then this is our 9th through 12th grade one, and this is the one that's definitely used the most. And again, as you can see, our topics are aligned with the EPIC tool, and when I was talking about strengths, these questions down at the bottom really match up with the questions that the strengths that we've identified in the EPIC tool. There's a lot of forms out there. There's RAPs, there's heads, there's gaps, and I would have loved to just find a form and just be done with it, because we've had to really evolve this over the years, and so it just feels like, really, did I have to recreate the wheel? But we really needed it to match the EPIC tool, and we've just made some more changes to it because we're about ready to move forward with Sbhc, which is the intervention around substance use. So I'm making some more changes to make this form kind of match up. So we have the pre-craft, and the other thing we have is the PHQ-2, because now our CCO is mandating that we enter in the PHQ-2. So this question, these two questions are PHQ-2, which then either our nursing staff or the provider enters in the flow sheet, and that's where Care Oregon or our CCO actually pulls the information from. So that's the problem, is we've had to evolve this to match all these, kind of requirements that we have, both for funding and for reimbursement. So it's kind of been this revolving door, and I'm just at the final stages of probably the 4th update because of the Sbhc that's coming out. So workflow suggestions that we have found helpful is, again, the clients will have an episode created initially and annually based on the date of their last completed assessment. We document in the episode, and what we do, we're trying to really move toward team-based care. So we do a huddle in the morning, and we look at all the patients that are scheduled, and we get together and we assess for what their health maintenance needs might be, and we also assess to say, okay, this kid needs a new episode, because we've been doing this since 2012. So if the kid had an episode opened in 2013, then we're going to go ahead and unlink it, resolve it, and open a new episode. And the other functionality that was built when we updated our tool is this .sb parent contact. And so I don't know if people are aware of it, but it's a really great way to kind of be able to follow if we've contacted parents, because that's one of our metrics we use on our dashboard. So the way you use it is, it's really easy. It's .sb parent contact, and then there's a drop down to say maybe if somebody was present at the visit, or let's say you made a phone call or a letter sent. So that's how we actually pull our data for parent-to-guardian involvement. So another definition, flow sheets. It's a spreadsheet for documenting patient care. It's set up by rows, groups, and templates. The EPIC supports both documentation flow sheets and review flow sheets. So I actually used to really like the flow sheet for the risk assessment. In all transparency, I don't really use this very much, and I will show you why. But to get to it, you go from the outside flow sheets and go to school-aged health assessment and strengths, and that information has been pulled on. So this is what it looks like. And the reason, and what we thought would be helpful is to see, kind of things change over time. So when you look, for example, over at 4/10/2012, and emotional well-being was preventive, then it was changed. So that's the other thing. You can go in and change the stratifications. It went to problem ID. The problem is every time they have a visit, this gets pulled in. So ideally, it would have been any time there's a change, so you can really follow it. But if you have some of your kids that you see a lot, like the frequent flyers, it's this endless chain, and it's really, for me, it hasn't been that helpful, but others might beg to differ. The other thing that's in there, though, that I do find helpful is this parent-guardian contact. So let's say I get a parent calling because they found their kid's birth control or something, I don't know, and I want to immediately see, oh my gosh, have I ever had any contact with this parent? I can go in here and see yes, where I have contacted a parent, or I've never had contact. So that's really helpful baseline for me in a really short amount of time. Have I ever talked to a parent or guardian about this kid? So I'm going to stop just for a second, but I'm thinking there's not going to be many questions, so I'll just give this about 10 or 20 seconds. Kate?
Sure. So actually, we did have a question come in from someone. It was, will behavioral health be part of the episode?
Well, so the way our mental health is in Multnomah County is they actually live in a different chart, different medical record. That said, if and when we do get behavioralists, they will live in our chart in the episode and within our work. But right now, the way Multnomah County is, they separate. They live in a different chart, which is not something I would ever recommend if anybody had control over it. But they would live here.
Doesn't look. Maybe we'll give folks, if you do have questions, please enter it into the question box. But it looks like
we can go on.
Nothing additional right now.
Okay.
If at any point something does come up, folks can enter into the question box, and we will read those during the next stopping point. So I think you're good to go ahead, Kristen.
Okay.
Oh, sorry. Actually, we have a question that just came in.
Okay.
At any point, do these health assessments get documented in a patient's note for that visit?
So that's a really good question. And the way that I document it and have recommended providers document it is if there's, so we have built in smart links into our smart phrases where we say reviewed a school health assessment. That's what a lot of our terminology is. But my expectation is if there's an issue or a problem, I really think that needs to get moved into the progress note. Let's say a positive PHQ-2 and we need to really comment on that. I think that needs to live in the body of the subjective and definitely part of the assessment and plan. So the negatives, not so much, but definitely once you start getting to the moderate and high risk, there should be something in the chart. That's my recommendation to people. So moving on to so then what this creates, and this is kind of one of the beauties of the episode, is it creates an episode report. And I think we've really, over the last year or two, really understood the value of having an episode report, and it's really not something I think we valued or really got initially, because at the time that we actually started moving forward with this episode, Multnomah County started moving more toward team-based care and really doing more pre-visit work where you're looking ahead to see what a kid needs when they walk in. So this is where the episode report has been really nice, is it pulls in a lot of different information for the kid in one spot. So you don't have to toggle through multiple different areas. When was the last chlamydia? When was their last well child? What is their problem list? So it's an avenue for doing pre-visit work, and there's a lot of health maintenance information in one place. So I want to show you how to get to the episode reports, because before this we had never used the episode. Again, in prenatal they have an episode report, in carcer there's a lot of different reasons for episode reports, but in school-based we had never used it until then. So it's always been there, it's just that we've never used it. So it's just in the chart review, and it's just under episode. And you double click and you look to see, again, your most recent active. So here you can see that this has been resolved from 2011, and this is what you click on is the active. Chart review, episode. And what's in the episode is a lot of things. It's the last health assessment, current vitals, social history, growth chart, the problem list, so you can really see kind of what the kids' problems are. Current medications, they separately pull in the last well child by the coding, and then we actually had them add, not every lab the kids had, but some ones that we actually are trying to monitor on a regular basis, so lipids, CT, gonorrhea, and the lead testing. It also brings in the depression screening. We, over the last 2 years, as we've updated some of our work, we've asked OCHIN, and they have done it to add a few more things. We are actually trying to, we've incorporated a lot of oral health into our practice. So when the last varnish was, and spirometry is in there too. So this is what the episode report, this is just the first part. You kind of have to scroll down, but this is the beginning of it where you can see the social history. We actually have our front desk people actually add information in the family comments, both if they have an outside provider, what school they go to, that whole who the responsible head of household is, and household members. And so that's a really helpful thing for me to see when I have to call home, or just a snapshot really quickly of this kid. So this, and then as you scroll down, you get their immunizations, and then this is where you can see their school age health assessment and the date it was done. So this is when I'm actually in the morning looking, I'm like, okay, this kid is due for a new health assessment because it was last reviewed in 2012. So the other nice functionality is you can click straight on the growth chart from the episode, and you can see their BMI, which is helpful. And just a couple tips I want to go through. One is if there is already an active episode, you cannot open a new episode. It will not let you. And the other thing that we found, and this was one as we were doing this work, we found the hard way, is you have to unlink, when they are due for a new assessment, you have to unlink and resolve and then create a new episode. So you have to do both things to resolve that episode. You have to unlink it first. So just some of our scrubbing tips is we resolve and open a new episode when the health assessment is due or at 365 days. Our expectation within Multnomah County is that all components or all themes in the episode are reviewed. So let's say oral health was not reviewed. Well, actually, we electronically pull that data, and so that client would not be accepted in our numerator that the health assessment had been met. So we have to go back in and then click on health assessment. So the only way that pulls in our report is if all the themes have been documented on. We don't include strengths in that mandatory reporting, but we do all the other components. So here's another stopping point if anybody had questions. I probably have too many stopping points here.
We do have another question, and I'm going to unmute May as well at this point, so
Great.
Please feel free, May, to jump in. So the question is, can you automatically insert health assessment into progress note, or do you have to re-enter it all?
I think you have to re-enter it all. What do you say, May? May?
Now you may have to, are you muted on your end?
Okay.
Oh, we can hear you. Hi.
Okay. Right now, we don't have a smart link created, but if that is something that people want, we're certainly willing to look into that to see what it would take to create a link that would pull all of that information. What I'm afraid of is that it would pull in everything, because each time you see the patient, somebody documents. I don't know if it would just pull in the last visit, because you might not be able to choose which encounter information you want to pull. It might just pull in everything in that episode, in that form, which may or may not be what you want in your progress note.
Thank you. The next question is, could we get a sample workflow from Multnomah County Health Department? So that's to you, Kristen. Is that something you might be able to share? I know Kristen was going to share the intake form for the health assessment.
We have two workflows that are written. I mean, we have this that when we trained, I actually tweaked this because we trained this a couple years ago. So we trained on this. And then I have some kind of videos or algorithms around when we do the health assessment and confidentiality and stuff. So I could look at what workflows that we have developed, and I can share them, and for however much that's worth to other people. But we do have a couple of different workflows. I don't know if it's just deliberately just on this, but I can look.
Thanks. Another, I guess, point of clarification is So the health assessments live outside of the medical record?
So no, they live. So what we do is they live inside the medical record. The other thing we do that I didn't talk about is the written form that we actually. I have really strong opinions that I think is important that kids write versus we verbally review these, because I think research is showing kids are more forthcoming and transparent when they actually write the information down. And so we get a lot of information on that form. So we scan that into the medical record. So that document is also put in, and it's really helpful for me when I have to go back to 6 months ago and a kid comes in and maybe has some depressive symptoms. I can go back and look to see how they wrote their on their form, 6 months ago or something. Does that answer the question?
If you have follow-up questions, you can enter it into the question box. One last piece is, I think, just maybe a comment for May and Kristen. The problem for me is with the episode is that it is very redundant. I would love to simplify by pulling in episode into progress note for well-child checks.
So the episode, and I don't know if I'm answering this. So the episode is just created that first time. Now, when we do the well child, yeah, you do have to click in and out and toggle in and out of the health assessment. And I can talk about my workflow with the smart set and how I move in the health assessment. I think the smart set that we've developed actually feels, maybe it's just because I have my flow where I figured out how to do the forms and toggle into the health assessment and then toggle back into the progress note. So I can show you kind of my workflow. But I must admit, and no offense to me or May or anybody that developed this, it's a little bit cumbersome. Is it the best we have? I feel like it's the best we have to actually document the work we have. I don't know if it's the best functionality out there, but it's what we have. I don't know, May, how would you respond? Or not? Anyway, I was part of developing it, so I get to say that I don't think it's perfect, but I think it's the way we can really document all the great work we do.
There's one other question. Do you ever generate a note for the health assessment? And if not, how does it exist in the medical record?
So the way it exists in the medical record, so it's always, you always have to do a SOAP note in the progress note. But you can say in the progress note, refer to the health assessment, because in that, and then you can do your comment section in the health assessment, because then when you go back to the body of that visit encounter and chart review, you can see all the notes that you've written from that one in the progress note. And May, I just want to confirm I said that right. So if she's muted, can you unmute her?
Oh, okay. Sorry about that. My battery died, so I couldn't speak. But I wanted to go back to the first question that someone had about using it in a well child visit. And that question has came up. Some people actually would like to be able to use the same form in a well child visit. And we have not gone down that path yet, because that might change the reporting data that people are tracking for the school-based sites. So before we entertain opening this form up in the well child visits, we would have to look at the reporting and tracking aspects to make sure it doesn't interfere with that. And Kristen, yes, you said it right.
So you can actually consider that a permanent part of the record, and actually is in the progress, not in the progress note, but in that visit encounter. Good to go, Kate?
Yeah, I think we don't have any other questions.
I do wanted to add that we always welcome any types of feedback, because you guys are the one using the system. So whatever you find cumbersome or things that you think would make it a little bit more smooth for your day-to-day use, please do let us know.
And I just have to second that with May. OCHIN's been very responsive. When we started including varnishes in our preventive services, and we requested that it get added to the episode, they were more than willing to do it. And I think somebody from the field, not Multnomah County, asked to add a few more topics, and I can't remember what they were in one of the theme sections, and OCHIN added them. So I think that they've been great partners in this. So the last thing I want to say, then I'm actually going to go to the demonstration, is we created a smart set a couple years ago because there were WellChild smart sets. They just didn't really fit into the work and the coding that we do. So we worked with OCHIN to try to build a Sbhc smart set, and maybe only Multnomah County is using it, but everybody has access to it. It just needs to get turned on. It includes all the components of a visit. It provides accurate coding. I think it's really efficient, and it's standardized. At least from our program, we have 13 sites. Everybody was doing something willy-nilly, and so when people were rotating to different sites, it's like, oh my gosh, what are you doing? So this was one way to say, and we mandated this in our program, just saying everybody's using a smart set for the WellChild and sports physical. So the next thing I want to do, and Kate, I'm going to ask for your help, I need to get into our release system. It's going to take me a minute, and I have to get through some confidential kind of records to get to it. So can you change the slide, and I'll tell you when to come back to me?
Sure thing.
So if anybody has any questions for May, this would be a good time.
We do have a question. I don't know if May, if you would be able to answer it, or Kristen, but the question is, if I work at an Sbhc and my WellChild check notes contain these elements, is there any reason to duplicate it by clicking through all these assessment boxes?
I will say from Multnomah County, we have to, because it's our reporting. It all has to do with reporting. So we do expect it, because that's the way we can track when it's done, because sometimes it's done in a WellChild, and actually sometimes it's done before a WellChild, that kind of health assessment part of the visit. So for our reporting, we have to, but I could see how if you're not doing it for reporting, there's no need to. Hey, Gwen, I'm having issues. I can't get out of this screen.
We have the
and
screen.
This is May. I wanted to echo what Kristen says. If you do need to report to the state of Oregon for your yearly audit and tracking of these visits for your patients, then you do need to use the form. That is how you could automatically have your data be sent. There are two different types of data that get sent. We send the detailed data on behalf of all the collaborative to the state of Oregon, but the audit data is what you will be sending to the state, and that is something that we will try to work on here so that you guys can leverage it in Reporting Workbench. So by using the form, you'll be able to leverage that report as well as once we get it developed.
Okay, I'm almost there.
Just let us know when you'd like us to switch back to your screen.
Yep, I'm good. Come on in.
All right.
Come on in. So what I did is I got into release, and I'm just going to show just a few basic things in release. So first of all, it's like just showing people how kind of the episode is right here. So clicking on episode, it looks like there's no episode. It's incarceration. So creating a new episode, I don't know, 3/5/2015, and then finding school preventive health, and then that's all we do, and it's noted that day, and that now it's actually linked. So that means that I can actually now work in the episode. And so you just click on episode, and this is where you do that work, and you do your work. And I actually, the way I do it in my visits, and I've been really, as I'm working with providers to be more efficient in their charting, I have this up, and I have the form that's being reviewed up, and I toggle back and forth. I do believe, our productivity expectations are, 14 a day, so we really have to do charting in the room. So I really believe this is an area where you can do charting in the room. And then again, it can say accept, but I'm finding that it says closed. So then you close it. So that's kind of how you open one. And then I'm going to now go into one that already had one opened. So again, just adding the information, and then let's say I want to go out again. I'm going to go ahead and close. And showing people what, so this is actually in the visit, so you can see, you know, you're in the visit and you can see what the information, you know, that this has been done and what has been written. And I do, you know, providers use this differently. I have one provider that this is the way she actually, updates this on a regular basis. She really fully utilizes this, not just annually, but during her regular visits. So the next place I wanted to go is I wanted to go to the episode report. And here's the episode report. It was opened in 9/17. And this doesn't have a lot of information in it. It's a fake chart, but just showing people we actually, so here's where you can tell if a well child was to be done, and they look at it 2 different ways. They look at it both by the level of service and from the diagnostic code, the B70 or 20, whatever. And then here's where the labs would be, if there was a PHQ-9, the varnish, scanned outside procedures. This is where you'd see the spirometry. And then the health assessment is down here. And then the immunizations are down here as well. So when I'm working with my CMA, I'm looking at some of the bigger picture stuff, and she's frequently looking at, you know, she goes straight to the immunizations because that's her world. So that's how we do the pre-visit work, because really there's not a lot outside of here, and the problem list is in here someplace too. So whatever was on the problem list, if it was contraception or depression or whatever, obesity, you can actually tell as you're moving down what kind of problems this kid has. And I job share. I have a practice partner, so I don't know every client I'm seeing, so that's super helpful for me. Now, for somebody who is not job sharing and knows every client, they may not need to use this with as much depth as I do, but I really depend on it because I don't know, like, a chunk of the time kind of who my patients are that I'm going to see that day, so I really need to do that pre-visit work. Now, the next thing I wanted to do is I wanted to show you the SMART set for well child in sports physicals. So this is the SMART set, and so I'm going to open the SMART set. And so what happens in our world is we have a CMA or LPN, and so what they do is they come in and do their part of, they start with their part of the charting, and I'm just going to go ahead and say, so we broke down the K-8 because there were different questions to ask from the 9th through 12th grade kids. So let's say I'm my CMA. I would enter that, and then we put the visit diagnoses, and so she would enter, you know, routine child. We also put some of the others in here too, the contraceptive and the overweight. And then we broke down the immunizations. We had one of our RNs really do a lot of research and say, what immunizations could you possibly need at this age and this age? And so what they do, the CMA actually will order the immunizations and link them to the well child, and it's all still toggling in this SMART set. And so you're just doing, she goes in actually before she even goes in the room and starts entering her information, and that's exactly what I do too. And then the procedures have to do with, you know, urine pregnancy, CT scans, chlamydia, and then we're doing fluoride varnish. So she's the one that's ordering the fluoride varnish in this. And then medications, I think we mainly have fluoride and vitamin D. So, and then she goes in and signs it, and then she gets out of it and then works on the outside, and then goes back into the progress note and enters her information. So I'm going to actually try something. I'm going to go ahead and now I'm the provider. I come in, and let's say they're in for a sports physical, so I'm clicking. I only have to click on this, and then my level of service is all right here as well. Okay, I don't know why that's pushing. Let me just try something else. Okay, and then I sign it. Maybe I can't sign it because this is in release. Cancel. And then what I would do then is once I had done that, then the level of service would already be there, the diagnosis was there, and so then I would go into my progress note, and I don't know if this actually came in because I couldn't do it. Oh, it did. So then this is what my progress note looks like, and I just F2 through it. And this is a sports physical, and the whole visit is actually written, and I have stars, stars, stars. Like, for example, we blew in school-age health assessment, and if it's a benign, I would just say reviewed. If there's pertinent positives, this is where I'd put pertinent positives. And then the other thing is I blow it in after my CMA has done all the vital signs, because this actually gets linked. And we're working with a coder now in Multnomah County, And she's just, you know, that's part of the important thing, is to make sure the vitals are actually part of your objective, because that helps increase your level of service for your coding. So then we do a really detailed oral health exam now. That's been changed. And then the whole assessment and plan is there, and we've actually added the oral health assessment as a separate assessment, and kind of what our follow-up plan is with oral health. And the other thing we have done is we've added the BMI as another kind of stopping point in the assessment. And this blows in the BMI, and then it actually also makes us write something about healthy lifestyle or labs indicated, and then also captures if we're doing parent contact. So to me, when we have a kid in with a well child or a sports physical, this is so great, because I actually can do half the charting before I've gone in the room. The other part of this I was going to say, though, is, okay, the way I do this is I might go ahead and start this kind of subjective, and then when I get to the school-age health assessment, I then go ahead and click in the health assessment right when I'm in the room, and I just start working it. So I am doing charting in the room, but it doesn't feel bad, and it feels like I'm working with the kid on it, and I'm going into the growth chart at the same time as that. So I'm toggling back and forth in the visit. So it really does take a certain level of comfort to do that documentation in the room, but I think it's efficient, and I think you can do a really comprehensive job and not feel like the computer is the patient. I think you can, you know, with some work, really work both. And so by the time I've walked out of the room, I've done probably 70% of my charting. So that to me, I have to just say, May, that's been great. I have a few kind of tweaks I want to make, but in general, I think this has been a really efficient way of documenting a sports physical and well child. So on that note, I don't have a lot else to say unless there's questions, or if May wants to add anything.
Kristen, this is Kate. So May, you are unmuted, and we do have one question right now. If people do have questions about any part of the presentation, please enter into that question box. But so this question that we have is, if I complete a health assessment after I choose that visit encounter, will the health assessment results show up if I view and print that encounter later? I.e., can the findings be faxed to other providers/clinics for patients seeing specialists or transferring care?
I'm going to let May answer that.
The information in the form is also in the encounter report. But if you do want to send it to a specialist, it might be more helpful sending the episode report, because it's more comprehensive.
Yeah, because what she does is on the calendar that she tracks on.
Hey, do you have anything else that you'd like to add about any of the tools from OCHIN?
So Kristen showed the SmartSat. It's fantastic. It was her whole team designed it. I just built it, and it is available for everyone to use. It's not restricted to any service area at all. But before you start using it, if you do want your own lab section, we can create that for you, because labs are mapped based on the lab facilities that you use. You can still use the SmartSat if you're opting out not to order labs in the SmartSat. Everything else will work. But if you want to order labs as well, like the one Kristen has shown you, then we can set that up for you.
Will everybody see the Multnomah County lab section?
No, they won't.
So we got another question. Which SmartSats are available that were discussed today?
Everything is available except the lab section.
Oh, because it says MCHD anyway. Yeah.
Correct.
Great. Give folks maybe another minute, but right now it doesn't look like we have any questions. And so, as I mentioned at the beginning, Kristen was kind enough to share the intake forms and the health assessment forms that Multnomah County uses. Those will be sent out. Oh, and there they are. Those will be sent out at the end of after the webinar is over, as well as a short evaluation that we would appreciate if you filled out. Anything else that you'd like to add, either Kristen or May?
I think I just want to let people know you know, I think everybody goes down their trajectory of works well with their practice. So I just challenge people to really kind of do what they need to do to make it work for them. And I'm totally available with our tools if people want to tweak or change or kind of make edits, or if anybody wants any extra, wants to email me, I'm totally available.
Thank you. Anything else, May, that you'd like to add?
No, thank you. Can you share these forms with us too? We are in the process of trying to create an LMS for this. We would also like to have the recording of the session if you would share it with us.
Sure. So we are recording this, and it will be available on our website. I'm going to be conservative and say maybe in a month. We have to do a transcript and have closed captioning available. But we will let you know when this recording is available.
Okay,
and
great.
As far as the forms go, I haven't gotten the final versions with the pre-craft written the way it needs to be, so I will probably get those forms to you with the final editions probably in the next couple of weeks. I kind of want to wait till they've been finally documented for us, because for people who are moving forward with Sbhc, it's you know, it's that great kind of pre-questions that you have to fill into the flow sheet, and we're going to have them exactly match what EPIC says, so that people the answers can get transcribed exactly the same into the flow sheet.
Great. So we don't have any other questions on our end.
This is Steve.
Thank you.
Is it Steve on your end, Kristen?
What'd you say?
Is Steve on your end?
You can hear Steve because he's in the office. He's just talking loud.
Oh, okay.
I'm trying to tell him to be quiet. That's my distraction. Like, shh, they don't realize I'm at a webinar. So anyway.
Okay. Well, I just wanted to thank you, Kristen, and May as well for taking the time to present this webinar. I think this will be really useful for many of our sites that are using EPIC OCHIN and looking for ways to more efficiently integrate these tools into their practice. So I think this is our screen. So as I said, this will be available on our website in about a month. If you have questions, feel free to contact our office. Or it sounds like Kristen is also available to answer questions if you have any. So I think with that, we don't have any other questions. Thank you, everyone, for joining us. Have a great rest of your Wednesday.